Hello everyone. In this video, I'll be talking about the health determinants of Aboriginal and Torres Strait Islander people of Australia and why the Indigenous youth and children of this population still experience health inequalities. Further critically examine strategies used to improve health outcomes in this population over the last 50 years. So we know that the Aboriginal and Torres Strait Islander people are the Indigenous people of Australia. These people are bonded strongly to the land, water and sea, socially, culturally, emotionally and spiritually, and were responsible for their own health through traditional healing practices. The Australian Bureau of Statistics reported that majority of them live in New South Wales and Queensland. So in 1989, the National Aboriginal Health Strategy stated that the Aboriginal people determines health in all aspects of their life. They focus and rely on the interdependent and healthy relationship of family and community. The invasions of Europeans brought about an imbalance in the life of Indigenous people in several ways. Overarching role of colonization led to a very poor health outcomes in the Indigenous population. Major factors determining health were lack of education, employment, poor living conditions, working conditions, racism, and of course poor access to health services. Environmentally, their lands were snatched to establish colonial businesses. They were forced into a mission. Thereafter, they lost access to resource, management, traditional food, and lifestyle. They experienced overcrowding living conditions and poor access to water, sanitation, and nutrition left them vulnerable to various diseases. There were epidemics of tuberculosis, and it is said that smallpox has reported to have killed approximately half of the population. There were other outbreaks of influenza, respiratory measles and pneumonia, causing and affecting the life and health of Indigenous population by leaps and bounds. Socioeconomically, they were very poor and made up of about one half of the health gaps between Indigenous and non-Indigenous Australians. Those with lower socioeconomic conditions reflected lower levels of education, unemployment and poor health conditions. Personally, there were very high levels of psychological distress due to stolen generations, causing substance abuse and mental health problems in elderly people and ultimately affecting their lives. Smoking is an expectant mother and poor antenatal care caused lower birth weight, twice the rate of non-Indigenous mothers. In children, it is said that there were huge disease and problems of, affecting the urinary tract infection. There were causes of diarrhea, intestinal parasites and anemia in Aboriginal children. Socioeconomic condition caused lower birth weights in infants with higher mortality rates. There were conditions originating in the perinatal period which dominated the mortality statistics, followed by symptom signs and ill-defined conditions, and of course congenital malformations. External causes accounted for about half of the death of Indigenous children between 1 to 4 years. Another important factor affecting life in Indigenous people of Australia were the location. Because they were located in a very remote area, they had very poor access to health services, and also because of poverty they could not afford much of the health services available. Racism affected the adolescents both mentally and physically, which associated them to increased behaviors of smoking, marijuana and alcohol consumption. Later in adulthood, there were chronic diseases such as cancer, diabetes and heart diseases which became more prominent. This represented the lag effects, which is an accumulation of health behaviors over time which commenced earlier in life. Lastly, poor education reflected poor health outcomes in Indigenous children and youth. So we know that inequality arises in the society and ultimately affects one's health. The determinants of inequality lies in the circumstances in which people are born, grow, live, work and age. The differences in health inequality has brought about a huge gap in life expectancy between the Indigenous and non-Indigenous children. Mortality has become another causative factor of health inequalities in the total population. According to the Mortality and Life Expectancy Report, the year 2010-2012 saw a 10.6 years lower life expectancy rate in Indigenous male compared to the non-indigenous counterpart, and 9.6 years lower life expectancy of indigenous female than non-indigenous ones. It is said that 65% of the indigenous adults die before 65 years of age compared to 19% of non-indigenous Australians. The year 2012 saw 1.8% of indigenous death all over Australia, causing 1.6 times higher mortality rates than non-indigenous Australians. Infants aged less than 1 year counted for about 4% of death of indigenous children compared to 1% of death of non-indigenous infants. So what brings about a huge gap in the life expectancy between these two populations? In my understanding, I believe chronic diseases brings about a huge gap in the life expectancy between these two populations. Researchers have attributed about 2/3 of indigenous non-indigenous gap of chronic diseases. The most common cause of disease reported was circulatory disease, accounting for about 26% of total deaths, followed by cancer. External causes like accidents, suicides, assault, endocrine and nutritional disorder, respiratory disease and digestive disease also. All these factors accounts for about 86% of death of indigenous Australians. Another factor increasing the life expectancy or the gap between these two indigenous population is behavioral risk factors and social determinants. Because these factors are interrelated to poor education, unemployment, low income, discrimination and poor quality of housing, affecting health outcomes both directly and indirectly. Researchers say that between 1/3 and 1/2 of the gap was due to social determinants. Suicide, transport, injury and assaults contribute to about 65% of death between 15 to 35 years of the population. Poor access to timely and effective service is another causative factor in increasing the life expectancy gap and bringing about health inequalities in these populations. Because of long waiting periods, care not available at the time requested, lack of service, obviously due to transport, distance issues, and of course lack of affordable and culturally appropriate services. These factors have particularly affected maternal and infant lives. So there are various strategies that have been implemented by the Australian government to improve health of indigenous population. A stress has been made towards a more holistic approach because health to indigenous population is a matter of determining all aspects of their life. Therefore, I will be focusing on the strategy to improve health outcome of mother and baby. Second, which is education to indigenous children, and a strategy to improve social and emotional well-being of Aboriginal and Torres Strait Islander people. Coming to the first strategy, various programs have been implemented by the government to improve child health and well-being, contributing to improved health, education and employment across the lifespan. Programs like New Direction and Health for Life gives primary care to the expectant mother, both prenatal and postnatal care, and also gives advisors and assistance in breastfeeding, nutrition, parenting, monitoring, developing milestones, immunization and infections. There's a program known as the Australian Nurse Family Partnership Programs, which supports indigenous pregnant women and giving parents assistance in future family planning. There's a program known as Strong Father, Strong Family, giving culturally appropriate health services to indigenous male to assist and help them contribute positively to the health and well-being of mother, infant and family as a whole. Coming to the second strategy, which is to improve early childhood education, schooling and tertiary education, the national government has funded under the Indigenous Act to improve and maintain educational programs of the Aboriginal and Torres Strait Islander children. Few of the implemented plans are parental and community engagement programs, Sport and Chance program, Indigenous Youth Leadership program, Indigenous Youth Mobility program and school focus projects. All these programs allow indigenous parents to actively participate in their children's learning process and support them. Various schemes support the indigenous children by providing scholarship both at secondary and tertiary levels to complete their degree and attain leadership skills and ultimately have a sustainable employment. Indigenous Youth Career Pathway Program supports Aboriginal and Torres Strait Islander students in year 11 and 12 to stay in school and undertake school-based traineeship. These programs have improved health, happiness, employment, income, and financial security. Positive indicator shows engagement of cultural activities and improved mental health. Coming to the third strategy, which is to improve social and emotional well-being, programs have been implemented to enhance existing counseling, family tracing, and reunion services to Aboriginal and Torres Strait Islander communities, and particularly focusing on the stolen generation. Target community care, which is the mental health programs, are being provided with expanded personal helper and mentors. The Healing Foundation strives to build culturally strong communities, especially for the stolen generation. Lastly, Headspace program provides culturally appropriate programs and services to Indigenous adults, helping them improve life via a holistic approach. So in spite of all these strategies being implemented by the government, there are still inequalities between these two populations because not enough work has been done to meet the said outcomes, and that progress needs to accelerate further. Work undertaken has been short-term and has not been evaluated in a robust way. Sometimes health services are not culturally appropriate and are too expensive. Therefore, as a nation, the Australian government needs to measure the performance in closing the gap and bringing about equity in health of Indigenous and non-Indigenous Australians. They should monitor progress in the delivery of power and control over the Indigenous affair agenda into the hands of Indigenous Australians. Thank you.